Well, hi there. Warm welcome. You're watching Times Now's Blueprint Explosive Exclusive, and I'm Meghna Deka. Well, Bollywood megastar Salman Khan, well, he has made a stunning revelation which really puts a very serious, important question and issue in the limelight. Something that will make you and me, everyone, sit up and think about how much are we pushing our bodies. Well, the bhai of Hindi film industry during an episode on Kapil Sharma's show has conceded that he faces some serious and rare health issues. In fact, Salman Khan has revealed that he continues to do the fighting and action scenes in his movies despite the fact that he has trigeminal neuralgia. Well, this in addition to aneurysms and the brain of the brain as well as AV malfunction. So what really are these ailments which are ailing Salman Khan? Well, this admission has caused a panic and fear amongst crores of fans of Salman Khan in the world. Is he safe? What will happen to him? Well, we are going to start first with the brain aneurysm. This is a bulge in the weak spot of the brain's blood vessel. What really happens? If it bursts, it can cause bleeding in the brain as well. And not just that, it is being linked to high blood pressure, stress, as well as smoking. These are things that you must watch out for in case you are also ailing from any of them. Also, brain aneurysms can sometimes be found only during scans, and it has very small, imperceptible side effects, which is why it's kind of hard to figure out if you have it. It also, if it gets ruptured, it can cause unconsciousness as well. We are, over the course of the show, going to explain to you what it is that you should be watching out for. So brain aneurysm, of course, is one of them. But let's also tell you how brain aneurysm is not a common ailment. However, several celebrities have somehow fallen prey to it. In fact, let's tell you who all have brain aneurysms. You have Bombay Jayashree, who's, of course, a very famous Carnatic singer. She had it. Sharon Stone has had it, Hollywood superstar. Then you have Tamala Jones, another Hollywood star, who also have suffered brain aneurysms along with Salman Khan. But let's also tell you what exactly it is that has happened. Remember, Salman Khan has claimed to be suffering from a health issue that is also known as suicide disease. What really is the suicide disease and why is it called so? Let's tell you. Well, this is known as the trigeminal neuralgia. In fact, this is something that Salman Khan says that he is suffering from. It causes electric shock-like pain in the face and makes it incredibly, cringingly, very, very painful for people to suffer through it. It can be triggered by eating as well as brushing, or even a small smile can cause a lot of pain. That just to give you a sense of how painful this ailment is. It is also a chronic disorder and the pain is tough enough to manage. Of course, it is very hard to manage this pain. However, they do put the patients on painkillers. Well, this is the suicide disease and many people are forced to take that ultimate step because it is so very painful. Finally, let's explain to you what really is AV malfunction, which is what Salman Khan says that he too is facing right now. Well, this is a rare tangle of abnormal blood vessels which causes AVM. Blood rushes from the arteries to the veins, causing this malfunction. Symptoms may not show for many, many years, making it very hard for the patients and doctors to detect it. Symptoms are simple things like headaches, like weaknesses. That is why it's very hard to detect it, but it can, however, lead to strokes in severe cases. Which is why today we are saying it's important to take your health seriously. In fact, let's go across to our panelists and get some straight answers. Dr. Gaurav Goyal is joining us. He is a senior director and the head of the Institute of Neuroscience at the Medanta Hospital in Gurugram. We are also joined by Avantika Shetty, an actress. Well, doctor, I'm going to come to you first. You must explain to us. This is something that Salman Khan has brought to light, but there is a deeper issue for all of us to understand. To what extent are we pushing our bodies? To what extent are we ignoring what our body is trying to communicate with us? You must explain to us. First, let's begin with the suicide disease. How difficult is it? But more importantly, what are the telltale signs that one must watch out for and raise a health SOS if they detect it?
Yeah, so very pertinent things Mr. Salman Khan has brought to light, and we must admire his courage that he has come forward and talked about these diseases, because there's otherwise this sense of keeping these things hidden. There's a lot of myths going around them. So I'll start with, like, because he has said he has all three, and trigeminal neuralgia is a disorder where the nerve, the trigeminal word comes from the trigeminal nerve. So when the nerve gets compressed or infected or swollen, it causes pain. So neuralgia is the pain of the nerve.
Okay.
So that's how we come to the word trigeminal neuralgia. Now, what is probably happening in his case is that he also has got AVM, which is an arteriovenous malformation, and brain aneurysm. And one of those, or probably both of them, are compressing on his trigeminal nerve, which is causing him this pain. This pain is, as you were saying, it's absolutely excruciating, and there is you do not know when it might just get triggered. So, for example, in his case, he
Right.
might be shooting, he might be trying to get an emotion on his face, and that might just trigger such a bad pain that he may not be able to function that day. So, but he has got a great grit, and that's why he has been going on with this for last 17, 18 years, and. So trigeminal neuralgia is the symptom, is actually of the
Okay.
disease, and in many cases we may actually not find a particular cause for it. So when these patients do come to our OPDs with these disease, we typically will order an MRI, and the MRI is to look for whether these patients have any abnormal vessels which is compressing. There sometimes can be
Okay.
tumors which is compressing, or could be just a swelling around the nerve or infection. But in most of the cases, in isolated cases of trigeminal neuralgia, MRIs and everything can just be normal.
Okay.
So,
That's very surprising that even in an MRI, it may not be detected. I'll just come back to
just
you,
the
Dr.
trigeminal
Goyal.
neuralgia. Yes.
I'll just come back because
Yes.
there are several other questions I must ask you. But Avantika Shetty, this is a larger malaise, isn't it? People, even ourselves, pushing ourselves to an extent where we think that we can live with it. It may be a crushing headache, it may be a blurred vision, but we all do it. I'm sure you in your industry would do it. I know everyone in news television, and I'm sure so much so in the medical fraternity as well. Everyone pushes themselves. When do we learn to say enough is enough? Or when will the body tell the brain enough is enough?
I think body gives us signals a couple of times. We tend to ignore it because we're so busy, and there's so much competition in every field, and especially in the industry that we are in. There's so much competition, and getting an I'm not talking about Salman Khan. I'm generally talking about other actors.
Absolutely.
Getting an opportunity itself is a very, very big deal. And when you get that opportunity, you want to push yourself and give the best. Your general working hours are 12 hours minimum, but they are never 12. It always gets extended to 14, 16, 17. There are times that I've shot like 32 hours at a stretch.
Wow.
And when you're in your 20s, you can push yourself. But then that pushing goes so much that after a couple of years, your body gives you signals and you tend to ignore. In my case, especially when I was doing television is very, very hectic, 14, 15 hours every day. I had developed symptoms of facial paralysis, which I didn't realize. One morning, I woke up with a swollen face and I couldn't feel my right cheek. My eye was watering, and I had to find it very difficult while talking. I twitch my muscle. So these neuro things are very, very common, because we don't get proper sleep, and body is so exerted. Your mind is always running. So neurological issues is very, very common, I believe.
Absolutely. And were you surprised, Avantika, when you heard someone like Salman Khan, someone of his stature? He's, of course, one of the biggest stars that we've had for many, many decades. Over these decades, he's been one of the reigning superstars of Bollywood. But even he comes out. It was a very heartfelt moment when he said that I've broken so many veins, I have hurt myself so much, and yet I am forced to continue to work. There's something very, very human about it. Avantika?
Yeah, I mean, it's like it's commendable that he's come out and he's spoken about his issues because, publicly talking about your weaknesses is a very big thing. And especially when Salman Khan comes out and speaks about his health issues, people will now at least understand that being an actor is not an easy job. And continuing to be a star at the top for so many years, it takes a lot,
Absolutely.
Yeah.
It takes a lot. And Dr. Goyal, it's important for our viewers to understand what really are these red flags that we should adhere to. This is for everyone who's sitting out there wondering, even I get constant headaches. Even I get blurred vision. What should you ignore and what should you send an SOS to your doctor towards?
Yeah. So I think very pertinent questions. So see, occasional headaches, each one of us do get. We have stress, as Avantika was saying, we work a lot. So the occasional stress headaches, occasional headaches which comes and goes is not a red flag. But so I'll start with the most severe red flag. If you are having the very, very severe headache that you are not able to function, you are vomiting, you are about to lose your consciousness or lost consciousness, that's an obvious red flag. But if somebody is having persistent daily headaches, they get blurring of vision, they have these sort of trigeminal pains, or sometimes they just may feel pain in one arm, leg, or weakness, or may be seeing double. So those are the cases where we say it's a red flag and we should get an MRI done. And the MRI brain and the MR angiography of the brain should be part of our annual screening packages because they will not only pick up these aneurysms, AVMs, they will also pick up on the carotid artery diseases, the other causes for strokes and something which is coming in. And I could see that you have a good list of celebrities going on,
Yes.
and you will realize Joe Biden, the ex-US president, he also had brain aneurysms. Emilia Clarke, who played in Game of Thrones, she also had while she was shooting. So seeing these actors and actresses, maybe because we are pushing our bodies too much, that may be one of the reasons. But more importantly, what we say is AVMs and trigeminal neuralgia are not lifestyle related. Aneurysm by per se could be lifestyle related to the extent that if you are not taking care of your blood pressure, diabetes, not exercising, smoking especially, then these are the risk factors which may increase your chances of getting your brain aneurysm.
So that is what you should definitely consider a red flag. If there are your lifestyle changes which need to be make it right now. Avantika, final comments. What would you like to say to people, everyone who's sitting there thinking, it's okay, I can cope with this. Let me push it another day. I don't really need a doctor. All I need is perhaps a Crocin, a paracetamol.
Oh, popping pills is the worst thing, you get a headache, you pop a pill. You feel dizzy, you pop a pill. No, you shouldn't pop pills for every damn thing. And like doctor said, one day you get it, second day you get it. You push it, and the pain becomes so much that you're dysfunctional. You don't reach that point. Consult a doctor, get the tests that are required, and do the lifestyle changes. And popping pills is the worst thing that we could do.
Absolutely, but that unfortunately has become the norm, which is why today we are having this discussion. Well, thanks to Salman Khan, who's been brave enough, who's been honest enough to come out and said, this is what I'm battling on an everyday, the kind of pain which is there behind the glamour and the glitz that he puts up on the screen. Behind the screens, it may be a different picture, which is why it's important that we listen to our own bodies and not let the brain override it. Well, thank you so much, Dr. Goyal, for joining us, as well as Avantika. Well, with that, we're going to be slipping into a short break. Don't go anywhere. We return in 2 minutes. Lots more lined up for you.